afternoon, everybody. I'm the National Project Manager for Health Education England's Dementia Education and Training Project, and I'm going to share with you how we've used film to raise awareness about dementia, and also to share with you some of the other education and training initiatives that we have developed within Health Education England. I'm sure that many of you in the room will know Health Education England's role and be familiar with it. But in case you're not, I've put up this slide. And so really to say our agenda is very much focused on workforce, education and training agenda, and centred on sort of workforce transformation associated with the 5-year forward view. And we aim to promote dementia awareness and ensure that the staff in the NHS have the skills necessary to deliver high quality care. And we consider providing access to resources as really key in able to transform that workforce and to develop that workforce. And we also see a very key part of our remit is working with other organisations across the health and social care sector to promote good education and training practice, to promote research, and really make sure that we maximise the use of the scarce resources that we do have. And we see today as very much part of having those conversations with you. So in terms of Health Education England receives an annual mandate from the Department of Health, and that includes the commitment to the Prime Minister's 2020 challenge. And I've listed here the sort of key deliverables that we're expected to deliver. I'm pleased to say that these are all on track. At this point in time, we have trained, or should I say, our NHS organisations have trained, and I know there are some individuals in the room today who have been very integral to that training. Just shy of 800,000 individuals have been trained to Tier 1 training, and I'll come back to the explanation of tiers in a moment. And we monitor that on a biannual basis. The 2 films that I've mentioned here, these have been developed, and really today is about showcasing one of those films for you. And our focus for 17-18 is to be looking at the Tier 2 training for staff who are working regularly with people living with dementia. And we have a range of initiatives that we're undertaking to support that. And I'm pleased to say that we conducted a survey recently on our higher education institutions, our universities, around commissioned undergraduate healthcare programmes, but included medicine, dentistry and pharmacy. And 98% of programmes could demonstrate Tier 1 awareness training at least, and many were looking towards Tier 2. So we feel that these are really positive, but as always, there's always room for improvement. So I mentioned just now tiers. This is the Dementia Core Skills Education and Training Framework. It was an initiative that was a joint initiative between Health Education England, Skills for Health and Skills for Care. And it supports the whole of the health and social care sector. It's designed for educators and for those who are caring for people living with dementia. The framework is a fairly simple structure in tiers, starting with raising awareness and the anticipation that all staff working in the NHS should have dementia awareness training at Tier 1. And then proceeding through the tiers to Tier 3, where the expectation is that those in leadership roles or in expert roles should have that more intensive training. And the reason why this is important is because it's not promoting a one-size-fits-all. And in fact, the research that's coming out of a longitudinal study that's being led by Leeds Beckett University actually says training does need to be tailored. So this provides some sort of standardization and really does focus on key learning outcomes. And we think through this, we will be able to improve the quality and consistency of education and training. And ultimately, this is because we want to improve the patient experience. So when we have used film, these are two of the films that we've focused on. Finding Patients is a film that really has a dual role. We worked with Dementia Culture UK to ensure that this was an authentic film working with the African Caribbean community. And this is to raise awareness of dementia in that community, but also it has another role to raise awareness generally amongst staff, but also start conversations about cultural sensitivity. And really to start to reflect and start that conversation about this is designed for the Afro-Caribbean community, but actually if we're looking at person-centred care, then look at the other sort of cultural issues that come to mind. Finding Patients, the later years, is set in a care home setting. It uses the same actress as Finding Patients, and really is a focus on her life a little bit later in her journey with dementia. And this is designed to look at how person-centred care can really support and improve the quality of care that those living with dementia can experience. I just wanted to share with you some of the other things that Health Education England are involved in, and really signpost you to our website, where we have a suite of good practice training resources, which importantly are free at the point of access. We have e-learning programs which are designed for Tier 1 and for Tier 2, and these again are available to all health and social care, including the private sector, and again are free of charge. And importantly, these resources are aligned to the emerging findings that are coming out of the What Works survey, which is led by Leeds Beckett University. And really just to say, we are continuing to work with various stakeholders to develop further resources that are very much focused on Tier 2. One of those packages is in relation to simulation training and is being rolled out through a train-the-trainer approach. And there is another package of training that we're developing, which enables organisations to take some of the resources that are out there from Health Education England, but other resources that you will be familiar with, and help to tailor those resources to meet the needs of their organisation. This slide here just has a selection of some of the tools and resources that we have. My colleagues here from Health Education England working across Thames Valley are on stand 5 with us, and they have produced a range of these resources, including Fred's story, which is around dementia and the risk of wandering, The Appointment, which takes Barbara from Barbara's story and puts her in a dentistry setting. And I'm sure you will be aware of the Time for Dementia initiative, which was a collaboration that colleagues in Health Education England working across Kent, Surrey and Sussex have developed with the Alzheimer's Society and the Brighton and Sussex Medical School. And I do believe that there is in the audience a representative who was involved in Emma Riley in the Liverpool Health of Memories, which again was supported by Health Education England working in the Northwest. And the Tier 1 training vignettes are a series of videos that are very supportive of Tier 1 training and take into consideration the good practice. I'm now going to showcase the Finding Patients video to you. I'm delighted to do so. I would warn you that when I've showed it before, if you haven't seen it before, some of the audience has found it quite moving. So I would ask you to prepare yourself for that. And I think even the team where we are very familiar with it, we still find it to be moving. My call to action to you today is very much around, please can you think of how you may be able to help us signpost and showcase this film further? Do you have any ideas where we might be able to take this through your extensive networks? And also, we have heard on Stand 5 where people are already using this resource as part of their training. We're delighted to hear that, and we would certainly like to hear other examples of how this resource is being used. It's actually been showcased recently as a sort of prequel to I Am Not Your Negro, a film documentary that is narrated by Samuel L. Jackson and was an Oscar-nominated documentary. So we are taking this out into the broader community, but anything that you can do to help us will be much appreciated. Thank you very much, and if we can roll the film.
This film is about what happens when a family tries to come to terms with somebody who's starting to experience the early symptoms of dementia. It's not just about the person who's living with dementia themselves, it's about the impact on the whole family. I think it's going to be particularly useful across the public sector, for example, to help people generally who may be experiencing working with people with dementia, even if they're not working in dementia services. This film was made to raise awareness for the African Caribbean community in particular about an illness that often they tend to think maybe doesn't impact much on them as a community. I want people to learn from this film that you need to talk about these issues. You need to be able, as families, and I think wider than that, with friends and colleagues, to talk about these concerns, to think about how you might begin to get some help and support with the worries. Not to close down conversation because it's a stigmatised issue. Not to close down conversation because black people don't talk about being ill, which is an important, difficult barrier, particularly in dementia, in terms of people getting help. And to feel that there is support out there, there is information about there, it is for them, and they can get access and help. It's a great film. It's a great portrayal of an ordinary family coming to terms with something that's very, very difficult, and some of the struggle that people go through, and begin to look for some help and support.
Hey, Mum. Mum? What are you doing?
Nothing. Just thinking.
Cup of tea? Mum? I'll make you one anyway. What's up, Mum?
Damn thing. I can't get it to work.
Calm down. Let me have it. It would help if it was the right way around. Ta-da! Surely not more strictly. I don't know how you watch this stuff.
Elliot's father couldn't get enough of me curry goat. That's why he married me.
Well, Elliot certainly didn't marry me for my cooking.
Oh, Denise, can you lay the table, my sweet? Donovan will soon be here.
Anything I can do to help?
Why did Donovan put this salt last? Lord have mercy, he's always doing this.
You're a silly nanny.
Oh, thank you, darling.
Hi, Mum.
Just checking the time you're picking me up for church.
As usual, Mum. 11:30. Everything all right?
Yes, of course.
Okay, see you soon. Love you.
See you then.
What's his name?
I forget.
Hi, Mum.
Hi, Elliot. Just checking what time you're picking me up for church.
As I said, Mum, 11:30. Are you all right, Mum?
Of course.
Sure?
Silly child.
See you then.
What's that about?
I'm not sure. Mum?
Sister Patience, what are you doing sitting there all by yourself? I was starting to worry about you. Sister Patience, are you okay?
Fine, just fine. As much as can be expected at my age.
Don't be soft, girl. You're still a spring chicken, just like myself. How is that sweet little thing of a granddaughter of yours? She must be at school now, mustn't she?
She'd just be 18 months old. Sleeps like a dream.
Funny. Looks like your friend Mrs. Clark.
No.
Yes, she does.
Look, Pearl got a bit. She looks. Oh, Elliot!
Jesus.
Watch my rug. It'll be stained now. Go and get the stain remover quickly before the stain dries.
All right, Mum. What? Mum? Why are there tins and tins of corned beef underneath the sink?
I don't know what you're talking about. It's nothing to do with me. Must be Chantel playing a game on me.
Mum.
You know how the child likes to play her games?
Mum.
Where is the stain remover? Move yourself, boy. I'll get it myself.
Mum.
Elliot,
Yes, Mum?
bless the table, please.
For what we're about to receive, may the Lord make us truly thankful. Amen.
Amen.
Thank you, Mum. You've outdone yourself. Oh. Quick, Denise, the planting.
Imagine if we hadn't been there. She could have...
But we were there.
And what if it's more serious?
It's just her age. She's just not as fast on her feet as she used to be.
Babe, you've got to get her checked out. We can't just ignore the fact that something really serious is going on.
Denise, just leave it, all right? Just leave it.
Donovan! Donovan! Donovan!
Okay.
Well, with your mother's recent behaviour and high blood pressure, I'm concerned that this could be more than just ageing.
What does all that mean?
I'd like to refer you to a memory clinic. We won't know for sure until we've done some more tests, but there is a possibility that this could be early stage dementia.
What? Say that again.
I understand your shock, but the good thing is that you both came to see us now.
It's a long time since you walked through here. Yep. This is it. Mama, you'll be okay. Trust me. I'll be right here. All right? Come, let's go.